like to take the time today to speak with you about the opportunities in the field of gerontology or aging. I'll introduce what gerontology is, the many different disciplines that it spans, what type of career opportunities are available, the different types of disciplines within the field, and programs that cater to those different disciplines. So let's begin with the word and the field of gerontology. We like to define, as gerontologists, the field as the study of aging across the lifespan, with the perpetuation that it begins at conception and starts all the way and continues from birth to death. It covers a couple of different main disciplines such as biology, sociology, psychology, and public policy. And you can find gerontologists are not only going to be much needed in the upcoming years, but will span across multiple different industries. Gerontologists are going to be the leaders of the future. We have aging populations, not only here in South Korea and East Asia, but in the US, countries in Europe, Middle East, South America. So they're very much needed, spanning from services that were involved going from retirement, the services that they're accessing, healthcare, insurance, but also social needs. So we need leaders that can guide our populations, guide our industries to adjusting to this type of specific need for the older adults. So those couple of different disciplines, biology, medicine, social sciences, public policy, we need research, and we have current researchers that are focusing within these different topics. In the biological sciences, we can look at geroscience, which includes translational sciences, neuroscience, neuropsychology. We also look at genetics, stem cells, molecular and cellular biology. So we're looking at vaccines. We're looking at anti-aging processes. We're looking at how we can transpose different genomes or regenerative properties from other animals into the human genetics. We're also looking at medicine. What type of medical needs can we reverse the aging process? Are there different products that can stop different processes of aging? We're looking at Alzheimer's, nutrition, physical needs, and physical exercise. We're also looking at potential cures. Alzheimer's and dementia, cardiovascular diseases, and heart attack are some of the leading causes of death in the United States. Are there ways to prevent it or completely stop it? We're looking at the psychological needs of older adults. So as you age, how does your psychological process change? Are there biological processes that are underlining that and guiding it? We look at some of the individual needs that are contributed from multiple chronic illnesses. So if you have diabetes and cancer, what are some of the long-term effects on your psychological psyche? Could also include some sleep patterns, stress, how religion plays a factor into that, or revolving around politics as well, how you take that to heart. We're also looking at the social implications. So loneliness, what type of interaction can contribute, or what you're bringing home from work at the end of the day, that type of stress. We're also looking at caregivers. Here in South Korea, it's pretty typical for you as a family member to take care of your loved ones or your older adults. And that's a huge burden to put on you, especially if you have a full-time job. We're also looking at public policy. So at the local, regional, and even national governments, what type of public policy is out there to support caregivers, older adults, or those that are going through the grieving process of just losing a loved one? So these are kind of the different areas that researchers in the field of gerontology are really focused on. There's different conferences that focus on each of these different types of disciplines, and future research that's much needed within each of them. So the career prospects are quickly expanding. In the US, in about the next 15 years, 1 in 5 Americans are going to be above the age of 65 or older. It's a huge amount of the population that also have a huge amount of the economic spending power. So they're looking to spend their money on services such as home modification products, technology, health insurance, and medical devices. But they're also looking at the travel industry, hospitality, and services that they can provide for their families and future generations. So within the field of gerontology, we see alumni of different master's and PhD programs not only pave the way into their companies, organizations, and industries, but are highly sought after. We're finding that there's a surplus of jobs and not enough qualified gerontologists to fill them. So what is a kind of common conception of what gerontology is? One that comes to mind for me is geriatrics or geriatricians in the medical field. But gerontology is so much more encompassing of that. So the difference between gerontology and geriatrics is geriatrics focuses more on the medical aspects. They really are preparing for the healthcare industry and healthcare professions. We're looking at nursing, medical doctors, pharmacy, dentistry, occupational therapy, and physical therapy. But they can do more than that if they're trained. They're really looking at the older adult holistically, and that can even occur in early adolescence, mid-adulthood, and continues on into later adulthood. One fun fact that I sat in on a lecture is a gerontologist or a geriatric specialist looks at the patient. And one of the first things he does is look at their toes. If they're cut, if the socks are on properly, they most likely are receiving either good quality care or can still take care of themselves. In which case, the treatment and prevention plans that you're about to prescribe to that patient may be applicable to them. But if their foot care is unhygienic, their socks aren't on properly, they can't put on their shoes by themselves, they most likely can't follow that treatment plan. So we need geriatric specialists with some of those tips in mind to really focus on the patient holistically and not look at just one problem individually. So geriatric specialists or geriatricians have that skill set to deliver that type of care. They're able to look at individual patients with multiple chronic illnesses. So if they have Alzheimer's and diabetes, are they able to take their medication on time? Are they able to take their medication when prescribed? But there's so much more that's involved outside of just the medical field. There's healthy aging. I was recently in Brazil and attended an adult dance class that was taught while sitting down. And some of those adults that attended, it was the highlight of their month. It was a free class to any adult over 65, and they looked forward to it so much. Some were commuting as far as 2 hours on the public transportation to get there because it's physical activity and it's social stimulant. Everyone there they get to talk to. They have physical activity revolved around it. And some of the people that they've met through the dance class, they've attended dinners, birthday parties, or special other events. So yes, while individuals can provide these social services or physical or mental services on their own, having the training behind it makes it that much more meaningful and applicable. So typically in the US, those 65 or older is kind of the retirement age. Here in South Korea, maybe 63. And as we extend the lifespan farther and farther and farther, there's a lot of older adults that have that spending power. So we're looking at nursing facilities. We're looking at retirement communities, long-term care facilities, but also the different types of services that those older adults are looking at, like that dance class. So some well-known gerontologists that are working in the field, they're going into all branches. They're looking at politicians, law. They're looking at the judicial system. They're also going into the finance industry, looking at accounting, marketing. They're also looking at the World Health Organization, taking their international skill set and going abroad. We have some that want to stay in research and academia, progressing the field. Those that are advocates and working in grassroots organizations or community nonprofits. And then we have those that are working within the National Institute on Aging in Washington, D.C., focusing on how to cure Alzheimer's and dementia, diseases that touch so many millions of people's lives around the world. And with the spending power, there's new emerging markets. One of them is age tech or applied technology within the aging realm. So that could be used for home modification devices, medical devices. It could be used in prosthetics or medical implants. But it could also be services to help you travel around the world, or hospitality or care communities. So I hope I'm able to share with you kind of the different career topics that gerontologists are able to touch. And I'll go into more within each kind of the disciplines within the field. As I hope I've already established, gerontology is very multidisciplinary. We're really trying to deliver direct services, make direct impacts in older adults' lives, but we're also trying to do that at a broader community level as well. Certain gerontologists are working as consultants for older adults and families. So what type of services are out there? Sometimes it can be overwhelming for a family that has a loved one that's recently been diagnosed and needs palliative care. What type of palliative care services are available? Or hospice care? If you know that end of life is quickly approaching, how do you prepare, or how do you make it more easable? We're looking at scientific research and different types and forms of study, how to get this education, this information into the communities and into the public. We're also looking at administration, civic planning, transportation planning. If you have a metro station or a bus that's not easily accessible for someone that may have a hard time walking or be wheelchair bound, they may not access or go to their doctor's appointments. So how to incorporate that into planning. We also look at the behavioral needs or sociological impacts of the lifespan. So if you have loneliness, or you're keen or not using social media, or a native to the digital age, and you're isolated at home because you can't move, what's that doing to your long-term health? These are some of the research leaders within the field of gerontology. They touch and they come from backgrounds such as demography, economics, socioeconomic status. They're looking and coming from backgrounds such as psychology. They're looking at the ages, differences in how sexes age. Men, women, asexuals, are they aging differently, the same, and how different diseases are touching them? What type of genetic effects could also be affecting this? So minority groups or different races. They're also looking at how memory can either decrease or increase. So, and the effects of other diseases on that. Memory retention, memory care. They're also looking at how stress or religion can play a factor into your aging process. If you're in a high stress life or job, does that affect your sleep patterns, which has even broader implications? These researchers' work is broadening into aging services management. And that is a discipline that focuses on providing these different types of products and services that cater to some of those other multidisciplinary actions. Some of the gerontologists that are working within this kind of section or subsection of gerontology are really looking at how to age in place, how to age at home. If someone doesn't want to go into a medical care facility, how can they do that? What type of technologies can dispense their medicine for them? Turn on the lights, turn off the lights without them having to get up. Could also be having or providing different services for accessing healthcare insurance and the public policy that it revolves around that. Closely related is long-term care administration. We need specialists that have an economic, finance, and public policy background to really administer the services within one of these types of facilities. So that could include retirement, assisted living, memory care facilities. We're also looking at the hospitality industry. Why does a medical facility have to feel like a hospital? Why can't it feel like a hotel or a cruise ship? Or if you have an extended stay within one of those types of medical facilities, what other services are available to you? Art classes, that sitting down while dancing class, things that get you involved or excited for the next day. But it's also so much more than just that. It's also looking at how to manage the staff of that type of facility, how to get meals delivered, what is a nutritious meal. Could also look at the marketing, consumer trends, and decision-making processes and also legal and regulatory affairs and how they all play together. With geriatricians, it's also important to have medical professionals within this field. In the US, there's only 1 in every 700,000 Americans that are specialized and qualified as a geriatrician. There's no way one person can cover that many patients. So we desperately need more geriatrician specialists. They're looking at polypharmacy. They're also looking at health tracking and e-data, how a patient that may not be a digital native interacts with some of these medical appointments or how to make some of these medical appointments. And then what is aging naturally versus aging with chronic illness or disease? Gerontologists also span the field of IT, design, and technology. So those that are coming from computer science backgrounds, IT backgrounds, or interior design backgrounds, how can they use technology to redesign spaces or make lives easier? If you have a loved one that's prone to falling and you install a camera in their bathroom or their living room to see if they've fallen, that may be invading their privacy. So what other technologies exist? Maybe a radar system or a sonar system, and how that can be modified into your home. Could also be looking at website design, social media design, or looking at some sort of FaceTime feature so that those that are socially lonely can interact with their friends. Gerontology also spans longevity and nutrition. We see gerontologists are going into nutrition and dietetics. That could be working with sports teams, physical therapy, private practices, healthy living. But it could also be looking at those that may have a chronic illness like Crohn's. What type of long-term nutritional plans do they need that will clearly affect the rest of their lives? Some of our gerontologists are working in the US as registered dietitian, nutritionists. There's different certifications and licensures that revolve around this. There's also a second licensure in the United States, such as the Certified Dietary Manager. So we're seeing certified gerontologists pursue that licensure. But food service could also include looking at corporate cafeterias, restaurants. It could be looking at food production, food safety, food management, food storage, and what type of benefits it may have for those that are aging with a chronic illness. Could also be looking at how the lifespan's affected through nutrition. If you have a plan that's preventative of diabetes or specialized for those that have cancer or Alzheimer's, what type of nutritional focus can they provide? It also spans nutritional science. If you're living in a city that's considered a food desert, so a food desert would be where you don't have access to quality food, or you only have access to a limited number of items or ingredients. Does that impact your health? So we combine a lot of these different disciplines into one. We have gerontologists that are focusing on just one. But what's important is that it's a combination. We see some of our gerontologists that are entering this field, and as a field, it's only about 50 years old or so. So they're coming from law backgrounds, they're coming from financial backgrounds, and they're seeing that there's a need or an educational gap in their knowledge about how to work with these older adults or this population. But it can also span into a smaller type and what we call geroscience. This geroscience is a relatively new term, about 5 to 10 years old, and it's a combination of translational science, molecular, cellular biology, the biology of aging, biomedical devices, biomedical sciences, and regenerative properties. Some leaders that focus within this subtopic are really looking to cure diabetes and cancers. They're looking at environmental effects of the aging process. If you live on a street with a lot of trees versus no trees, are you more prone to respiratory illness like asthma? They're looking at neurodegeneration and neural pathways, how we can kind of recombine them or why certain pathways are broken. They're looking at genetics and the genetic processes of proteins, which are linked to nutritional physical needs. And they're also looking at how sexes age differently.